Today, y'all, Deion Sanders announces that he beat and battled bladder cancer. Now, this is kind of surprising. We did not know he was sick until now. In fact, there are reports saying he didn't even tell his sons. But he did a press conference with his urologic oncologist, his urologist, who, by the way, is a woman. So, boop, boop. And apparently he got diagnosed with bladder cancer. And ultimately he underwent like major surgery to remove his entire bladder. Apparently his cancer was discovered on routine imaging, CT imaging for something else, and they saw it. And turns out it had invaded the wall of the bladder, but it was not yet into the muscle. So bladder cancer starts on the surface of the bladder lining, and then it can invade into the wall, and if it's deeper it can invade into the muscle, and then it can invade beyond the muscle and even to nearby structures. And so the deeper it invades, the worse it is. When it gets into the muscle of the bladder, we got to take the bladder out. His had not invaded the muscle, but he opted to get his bladder removed in any case. And that is a slightly unusual decision, but I can understand potentially other factors that might have led him to that decision. So when we remove the bladder, we have to create another way for urine to get out. So we have to create like a stoma in your belly, which empties into a bag like this. Or we have to create a new bladder by using a large segment of your small intestines. We kind of patch them together. We open the intestines up, we patch them together, and we put them into this sphere that connects to your kidney tubes and your urethra, allowing you to pee as if you had a normal bladder. Coach Prime, Deion Sanders, decided to create a new bladder. Now, it's important to know that patients who have neo bladders and new bladders aren't completely like normal bladders. They may deal with incontinence or leakage. They may have to intermittently cap their bladders. Well, bladder cancer is among like the top 5 cancers in men. The biggest risk factors: smoking, age, male gender. So there's no screening test for bladder cancer, but if you ever see blood in your urine, especially if it's painless, or if somebody finds microscopic blood in the urine, important to see a urologist to make sure you get a workup and that you rule out bladder cancer. So I'm wishing Coach Prime really continued strong recovery and continued disease-free.